Yes, you are.
Here in this restaurant, I'm the head chef. The Times newspaper, the national newspaper, actually go around the whole southeast and they make a report or the documentary about vegetarian food. And they said vegetarian food is not boring anymore as people used to think. And they come up with 10 best vegetarian restaurants. And we are among that 10. We prepare everything here fresh. We don't use microwave. We don't use any refined food like white rice or white bread or white pasta. Hardly you find sugar in anything that we do here. As I said, it's a healthy lifestyle. So we are very careful putting the ingredients together. And that makes us unique, I may say.
The health habit or the lifestyle for 30 people has changed in the church. Their eating habits has changed, their sleeping, their exercise program, the water program, and we now have a water challenge to follow in the microchip. And I was so surprised with so many people coming on board because one person who's done the chip tells somebody else and tells somebody else, and it grew. And so you have a whole list of people who are saying to me right now, I need to buy new clothes. My blood pressure has dropped. My blood sugar is not as high as it used to. Thank you.
If you're interested in knowing about your diet, how you can reverse all the problems you've got, high blood pressure, diabetes, and cholesterol, just give us your name and address. We will contact you.
Pastor, how's the microchip program impacted your church?
The microchip program has been very well received in the church. It has raised a buzz of enthusiasm. Many of us who have attended the program have benefited with just, number one, reminders of those basic ingredients of good health. But also for some who are there for their first time, they stand out to be an eye-opener in some areas of their lives. And some have been able to make very radical changes. We have lost some weight, many of us. We have been reminded of the importance of the everyday good health practices.
So many people circulation free. Water, diet, and exercise. Choices that improve our lives. Choices that improve our lives.
Yesterday I had someone come before the church to talk about the water, increase in water they were drinking, and it improved their skin condition, and improved all their circulatory system and even the bowels.
Yes, I'm a senior nurse and I'm also a sister at the Hammersmith Hospital. And I am trained as a diabetes nurse as well, and also to take bloods because that is very important when we are looking after a patient with diabetes especially. We need to get their bloods taken, and every day we've got to do that at work periodically to make sure that their blood glucose is at the right level.
So what was it like taking bloods for the microchip program?
Well, that is very important because the same standard that you're using in the hospital, obviously you've got to use that same standard because you've got people coming in with different levels of blood. And not only that, but you need to have them consented first because that is very important. And as the person consent, and then you normally would ask them certain questions. Are you on heparin? Because those sort of patients or persons will bleed a little bit than others. So you make sure that before you take the blood, you explain to them, you make sure that you've got cottons and make sure that you've got a little plaster to put on their hand, and make sure you look after them in a special way after they have finished
Hi, this is part of the route that we take to take the blood from Chiswick, where we've had our microchip program, to the Path Lab in central London. We take an interesting route. We pass by the Lubats Apollo along the A4, come down through Chelsea. This is the Chelsea embankment you can see there. We go along the Thames here, up the road, past the Tate Modern, round the House of Parliament, past the London Eye, and then we cross the London Bridge, deliver the blood, and wait for the results.
In England, heart disease, like any other part of the world, the Western society, is on the increase. People are eating, the obesity is contributing to it, diabetes, the silent killer, high blood pressure, you've named it. And in this society, we have got it. And therefore, with this information, we would like to share it with our community, our neighbors, our members, so that they can improve their heart health.
Now, food and drink, we need it daily. But we can be putting the wrong things in this body, and it will cause a lot of damage to this body.
Heal each man, each body and its soul. Give us wisdom that will make us whole. Let us eat us from thy hand. Fruit has grown on second hand. Fruit has grown on second hand.
This is chickpea curry. I also said to you earlier that we are different. In most restaurants, they buy the curry, prepare, and everything prepared, they just put it together. But we start this from the scratch. And so, as time goes on, and if we start preparing and doing some cooking demonstration to the chip program, we will demonstrate how the chickpea curry is made.
Doing the microchip, I think it's togetherness helps. When the sharing helps, the recipes help. So you find I am not doing this thing alone, and hopefully in the near future we're going to be planning an exercise program where we would exercise together. So yes, it has benefited the church, and it's going to be a buzz in Chiswick for a while. The way folks are even asking for a second program.
So it's been one of the good things that has happened in our church, and I'm looking forward at how we can be able to develop it even further.